Welcome back to the webinar on coping with uncertainty during the COVID-19 pandemic. We had a session on Monday, the 27th of April, where we had a few questions that we left unanswered that we will try to answer for you now in hindsight. And the first question is to Professor Anna Forsberg. What is the best way to communicate between organ recipients and the transplant units or outpatient clinics during the pandemic?
Well, during this pandemic, physical visits to the hospital or healthcare should be minimized. But instead, we can use both mobile health and e-health solutions. And I think they should be used more frequently. And I think it's a perfect opportunity now to further develop these tools. In countries in Europe where national e-health platforms are implemented, you could ask for a scheduled video consultation with your transplant nurse or transplant physician or the professional that you need to talk to. In Sweden, for example, we have this mobile platform developed for smartphones. It's called My Life, My Health. And it's for organ recipients. And through that platform, we can send out questions. And also the patients can ask questions that we answer within 5 days. And finally, I want to emphasize that physical distance doesn't mean emotional distance. So uncertainty can be relieved without physical contact. And I think it's an important aspect that we communicate through the available digital solutions.
Oh, so then the second question is, should transplant centers be responsible for their patients regarding medication supply and their health and get in contact with them?
Well, that's a good question. And my perspective is that as a capable human being and a person with power over your own health, you share as a patient the responsibility with your transplant unit. The transplant unit prescribes your medication and should be there to support you when you need their support. But the self-management activities involved in being an organ recipient is mainly your responsibility. And it means like you can still continue with healthy eating, doing your physical exercise, even if it's a bit limited, maybe because you are allowed to get out as much as you want. You should continue to avoid infections and take your medications as prescribed, and also continue to monitor your vital signs in the same routine as you have done before. So it's in conclusion, it's a shared responsibility between you and the clinic, but you are in charge of your own health, basically.
Thank you. And the third question is, from your point of view, and just in a few words, what will be the very first necessity or duty that you will have to deal with as nurses or as surgeons as soon as the whole system restarts?
Yeah, and we need to look forward to phase 2. And I think the most important thing is to reestablish trusting relationships with the organ recipients. And to, as a professional, you have to focus on to help the recipient to get out of their possible state of uncertainty. I think it's important as a professional to acknowledge the fact that the organ recipients made a great work during this crisis with very little support and adopting a lot of self-care activities without the support from us, actually. And I think also the third thing is that we should keep the routines we have developed during the pandemic with both e-health solutions and m-health solutions. And because I think it's a good thing. It promotes autonomy and self-efficacy among the patients, and it's a good way to communicate. So let's keep the good routines and still try to reconnect as much as we can.
Thank you, Anna.
Thank you, Peter.